At-home genetic testing, or what's called direct-to-consumer genetic testing, is becoming really popular. In 2017, more people had direct-to-consumer genetic testing than in all the years previous. So we are seeing a lot of women come into clinic, probably about one a week now, with genetic test results that they want us to help them interpret. So we've learned some lessons from that. The first lesson is that when a woman has a positive test result, it may or may not actually be positive, and that needs to be retested in a CLIA-certified lab. Particularly when they are receiving a genetic test result, they can then get the raw data, and they're running it through a third-party company like Prometheus. So oftentimes it'll say they have a pathogenic variant when they indeed do not. We had a woman come into clinic in that exact scenario. We retested. She did not have a BRCA1 mutation like she thought. And she was happy and relieved to realize she didn't need to do any extra increased surveillance. The second lesson we've learned is that particularly 23andMe is offering BRCA1 and 2 genetic testing, but they are only offering the 3 variants that are associated with Ashkenazi descent, which is Eastern European Jewish descent, which most people in the world, most people in America, that is not the test that is needed for them. So if a woman comes in and has a negative test result from 23andMe, then we know that she's not been tested for most of the variants, and she also needs to have repeat genetic testing to consider her for breast and ovarian cancer risks. The third thing we've learned, or that we've always known but we continue to know, is that family history is still important, even if her genetic testing results are positive or negative. It's important to consider for when he or she might start screening for particular cancers, or when he or she might consider risk-reducing surgeries or medications. And the fourth thing that has impressed upon me most is that patients want their genetic information. They're willing to pay money for it and spit into a cup and mail it to a company, and the companies are listening, and they have given this to patients or consumers or whatnot. So our challenge as healthcare providers in genetics or primary care or OB-GYN is to rise to this challenge and to help women navigate this difficult space when they get genetic test results and they're not sure where to go with them from there. So we either need to work on making sure that we have the right advice and we understand this testing ourselves, or everyone needs to know who that person in their local community or regional academic center who has expertise in genetics and how to help women interpret these results and understand where to go from there.